a better structured way, so that you should not be haphazardly preparing for the theory exam, because theory is the first, I would say, the stepping stone to the the final practical as well as getting the exam cleared. So that's why all of our team members, they decided, though it was a very short notice, but we could make it happen, that before we will be going ahead with our formal course, again the course pattern and the schedule also we have to prepone, because we were like not initially very sure to start it so early. Rather, it was planned for May second week, but because of the preponement of the exam itself to July last week, so we thought we have to also prepone our the program, the exam preparatory course. But still we would be trying to cover up everything that we normally try to finish in our long course, that is the top long course. We name it as top, means it is theory, OSCE and practical. So I would be going ahead with a little bit of basics, then I would be handing over to Dr. Darshan, who is the coordinator and facilitator of the whole program for last many years. And then we would be also getting the feedback of our the gold medalists. We have two gold medalists today. Dr. I would say, rather, please pardon me for my mistake. We have three gold medalists. Dr. Darshan is the first one who has received the gold medal last to last year, because the NB normally announces for last 3 to 4 years in one go. So you will not be able to know who are the the gold medalist for last 2 to 3 years before they announce it in one go, and they organize the convocation in 1 year, and then again 3 to 4 years they don't the organize. So that's why we didn't know that we have one of the gold medalist among us as faculty, though he was our student, and then he joined our academy as a, I would say, superstar, or the star in making initially for 1 year. And 3 days back or 4 days back, when the result was announced for the convocation, so we also got to know that Dr. Srihari Rajkumar has also been selected, or I would say he has won the best, the President's Gold Medal Award for the October 2023. That was so surprised. Like we were like, though he was a brightest candidate, but again, getting the gold medal is something else. So it's no, all the students are no, they are successfully cleared in our different courses. But again, and just after 15 minutes, we got to know that Dr. Amy Ambuken from again Thrissur, and now she is the assistant professor in Amala, the government medical college, and Kerala. So she has also awarded the gold medal, President's Gold Medal, for the last January 2025 exam. So these are two of the major achievements. And before that, Dr. Darshan Prakash has started this series of gold medals that we somehow can boast upon. So with this pleasant, I would say, very happy news. So today's agenda, I would announce, or I would start with me. We have Dr. Sanant Kumar Das from Australia. He is my colleague, friend, and also the course director. Sanant, good evening. And we have
Good
also,
evening, Tapas. Sorry, I'm on the phone, so it takes a
no
bit time
problem,
to
no problem.
connect. So
Yeah, no problem. So it's a short notice meeting. So everybody joined in despite their busy schedule. Now we have also Dr. Darshan Prakash. I have already introduced a star player for our top academy and also 360 critical care. We have also the Lady Luck with us, Dr. Niharika. Hello, Dr. Niharika from
Hello,
Bangalore.
hello, sir.
And we have Dr. Srihari Rajkumar. Still, we are waiting for his arrival. He would be entering us with the red carpet. So we are expecting him to join at any time. And also Dr. Amy, who will be also joining today to share her how she prepared, how she the made of the time, and also the structure, how she has actually designed in despite busy schedule. That would be very helpful for all of you to know and prepare for next 3 months. So with this background, so I would be
Dr. Bhavani
just
is also there, sir. I'm sorry. She's also tuned in.
who?
Dr. Bhuvana
Yeah,
is
Dr.
also
Bhuvneshwari.
joining.
Yeah, she is our international faculty. Again, hardcore academician, and we are really privileged to have two lady lucks with us, Dr. Bhuvneshwari and Dr. Niharika. And Dr. Bhuvneshwari is right now working as consultant in Dubai. And she is like contributing to the different like the course materials and also designing the new updates also regularly for our top courses. Now, with this background, I will be just sharing two slides, then I will be handing over to Dr. Darshan. Now, the idea why we started this 360 critical care, because many of you must have joined for the first time and knowing about this 360 critical care. What is this 360 critical care? Why we have chosen 360 and then again top, because you are all top people, and so that's why should deserve or like you should get a top course. So that's why top course and top theory, OSCE and practical for your DRNB and DM critical care exam. So the idea behind starting this 360 Critical Care Academy 4 years back is to create a generation of clinically strong, exam ready and globally competent intensivists, not only in your own region, country, rather you should be ready to face the world at the international level. Now, what makes 360 Critical Care different? We always believe in structured learning, that you will be again and again listening from our like faculties in different classes. Again, we have very strong mentor and mentee relationship throughout our last 4 years. We have very, I would say, a one-to-one interaction with our candidates over last 4 years, and we try to build up focus on the concepts of critical care. We never try to just focus on the answers, maybe rather I would say it is the foundation, the basics that need to be cleared, then only we can like build up the remaining things. Now again, finally, whatever you do, you have to provide results, and we all know how like the results are coming for our different courses. And again, the real world critical care has to be integrated. We have to be future ready. Now it is trusted by trainees and consultants across India and again beyond for high impact critical care education, not only in India. I would say for our international courses, people, trainees from different parts of the world are joining, and they are also like giving very positive feedback. And again, it's not only coaching, rather I would say this is a movement to support the dreams, the discipline and the distinction in critical care. Now, today we will try to support the DRNB DM, and we have other courses also like EDIC and the fellowship, Indian as well as the international fellowship exams under one academic ecosystem. And something in the last line, I would say, we have never tried to like provide something from like from one academy only, rather it's built with passion and powered by the purpose of delivering something that we didn't have in our training period maybe 10 years back, 15 years back. But yes, now we try to deliver it to our future generation, current generation. And again, it is driven by the success of every learner. So with this, I want to hand over to Dr. Darshan Prakash, who would be guiding you how you should be taking the next 3 months to get the best out of your like your exam preparation. In the
Thank
meantime,
you, sir.
Dr. Darshan sharing, Dr. Sannant, if you want to put few words, then Dr. Darshan would be starting.
Thank you, Tapas, for that great introduction. And you are meant for it. I think you are the introduction master, so that's why you are the opening batsman of the whole team. Anyways, I welcome everyone, and really, it's a great effort from the whole team to make this course and conduct it over last 3 years, which has produced great result. And this time the uniqueness of it is the questions that we are going to prepare, around more than 40 questions, which are totally out of the box. Like, I was surprised to see what are the questions being asked in the DNB exams. And I would have difficulty in facing those questions in the exam. So we will be talking about those 40, 50 questions which are totally out of the box. That's the main attraction of this 2.5 months course. Along with that, you will also if you join the course, have access to the usual questions bank, etc. But the main attraction will be the topics that we'll be talking about, which are really different and being asked in recent exam. I'll not waste much time. I will hand over to Darshan to take forward, and I welcome you guys. Thank you.
Thank you, sir. Uh, I think so, sir. Both Sanajay sir and Tapas sir has already summarized as to what our approach is. Basically, we want a quality learning and quality approach in critical care. Whatever the exams throw at you, we just want you to be confident and answer it. The results really do not matter at the end, but whatever you do, you have to give it your best shot. That is the thing that we want you to do in 360 critical care. So definitely, I do understand we all intend to clear it in the first attempt. That is the goal. We have seen that as well in the previous years. But NB throws in googlies, like sir was mentioning earlier, that is really difficult. We have seen people answer everything, and despite that, they have not been able to score well. But that shouldn't put you down. So we are looking at areas where there were errors, where things could have been improved in this particular course, so that we'll answer it to the point and probably get better scoring than last time. Last 2 years, the major feedback that we all got was despite us writing the correct answers, we have not scored well. So we're looking into what was NB looking in, while scoring. So probably they have a particular format in which they were scoring, or else particular point was not highlighted, or it was too much out of the point and very few things which were related to the questions. These are the few things that we could gather in when we looked at the answer papers which were shared with us. So we were trying to go through all of them and then format this particular course, especially in the mock exams, so that we'll let you know how to approach your exams, which are due in another 2.5 months or so. So without wasting much time, I think so I'll just go through the roadmap, because the time was very short for your exams. It's a 2.5 month period, or roughly 3 months is what I'm taking into consideration. You do have your thesis. I know there is shortage of time, so we thought we'll keep it as a hybrid. We have good quality recorded classes from the previous session, so we will be sharing them. And roughly, as I was mentioning, 40 to 50 new questions will also be added with the newer updates kept
Darshan,
in
have
mind.
you shared the screen? I am
No,
unable
no,
to
sir.
see.
I'm yet to start my
Okay,
presentation.
no problem, no problem, no problem.
Yes. So we are keeping in mind the newer questions as well. So we are thinking about them and then focusing that as well, so that you do not waste time on going through the guidelines. So we are trying to segregate all those newer updates, give you a short brief about it, so that you remember it in a theoretical aspect for the exam. And with this, I'll start my presentation. And before that, I would again like to congratulate Dr. Srihari, who has been a great role model to a lot of people, especially through his notes. The dedication there itself was something that moved us to request him to join our courses way back in 2022-23. So that, I think so, has been really good, and that motivation, I think so, the fruit of that was this gold medal. Congratulations, Srihari, again. And Dr. Amy, it's just like icing on the cake that one more person from our academy has got a gold medal again this time. So gold medals are not the thing that is always that is aimed for. It's just a validation of the efforts that one person has put into it. Didn't define them earlier as well. It will not define them further on, but it's just a validation that their efforts are being recognized and they are being rewarded for whatever the efforts they put in. So with that, we'll start with the roadmap for 2026 exam. I know you guys have a very short period of time, so I just wanted to answer this question, because most of the people were asking us, how do we approach? We have a very short span. How do we approach? So this is just how to prepare in the next 2.5 to 3 months time that you have. So this is just a guide to help you. Okay, it's not something that is a specific instruction from National Board. It's based on feedbacks that we have received. We are trying to tailor make a few questions and answers so that you approach the bouncers accurately and answer the ones which are concepts correctly. It might not cover all the topics. The course aims at covering at least roughly 70 to 80%. The 20% is really difficult, and you guys have to look into the recent updates, because that keeps changing. Okay, so for a few of you, things what I discuss further on will already be known. It might just add as a reminder. Okay, so we all know whenever the date, as soon as it was announced, all of us went into a mode of shock, and we were not able to take into the fact that the exams are so short span away. So the only thing that we want to do from our end is to make you relax, focus, and have a clear approach as to what to be done in the next 2.5 to 3 months. So the causes of worry for every exam going PG is an imposter syndrome, wherein you feel like whatever I have read, is that enough? Am I doing something wrong? When will I complete? All of this comes into your mind. Okay, there's always the fear which comes with imposter syndrome that you might not clear. Okay, and the biggest thing is NB throwing in googlies every exam. You keep thinking that, is this format the same? Is first paper only going to contain basics? Are they going to ask recent advances? Are statistics going to be there? How many questions? So this is something that we all keep getting the questions, and we still don't have a correct answer as to how many questions. Okay, so all of this will always be there. There are always knowledge gaps that is going to be there. Okay, with all of this in mind, we all know that there is very little time. Okay, so this, along with past news of failures and fear of being having higher expectations, perfecting a certain answer, all of this adds to the worry of exam PGs. Okay, so this is what I want you guys not to have. If you have a clear approach as to what to do and when, probably you will come back doing good. Okay, that is what is of the essence right now. Okay, so first things first, is 2 or 3 months enough? Will I be able to cover everything? What should I do about my thesis? This is the biggest question that I get asked. Okay, so how do I manage study and duty? This is again another big question, because most of us are still working before our exams. Probably you'll get 2 or 3 weeks, at the best 1 month. Correct. So what do we do? So keeping all of these queries in mind, I just formulated a probable approach towards your exams, so that might help you. Just listen me out. Okay, so time is of the essence. That is what we need to respect and address. Okay, so always start with a plan and stick to your plan. Remember, sticking to the plan matters more. Okay, making a plan, everyone makes it, but sticking to the plan also matters. Okay, so the issues are, you have 3 months, frequent duties, and 1 month at least, because of your leaves, you might have a complete focused preparation. So these are the things that you have already. So what are the things that I want you to divide is, you should have something like a must do, you can do, or you can skip. Okay, so you divide your topics or issues in these three ways. Okay, so this is a rough idea. You can divide it into anything that you want, probably urgent issues and something that you can skip or do it later. Okay, what I want you to understand is, can do and must do is something that you have to complete. Okay, so in must do, if thesis is irritating you, please try and complete it as early as possible. Okay, keep a deadline, probably first week of May, and chuck it. After that, don't bother about it. If your dates have not been announced, if the date of submission is not announced and you're still okay with it, probably you can take the risk of going behind on it. But then I would say, if you keep that thought out, then you can clearly focus on your exams. If that is bothering you, please address that first. Then the must do is your core topics, all your systems, all your recent advances, all the previous question papers, okay, that have to be done, along with recent trends, which are usually discussed in conferences. Okay, the best thing is for you to look at the update books. Okay, so if you see some topic being repeatedly discussed in many CMEs or in the national con, probably that is a question that they are focusing on. Okay, so that is one cue for you to pick up and learn on it. What do I mean by can do? These are topics that you have previously presented in the departments, or you have gone and read about it, heard in some CME. Okay, so these are things that you have some basic knowledge, but you need to brush up on it so that you can prepare it well. Okay, so always these two club it together, probably you'll not waste much time. Correct. So this can add to your boosting. Okay, so you can boost up your confidence so that you can build up the pace and then build it there onwards. Always have a peer study group if you're okay with it, but in each individual is different. If you're not good with group studies, try and avoid it and do it alone. Okay, if your productivity is good alone, keep it. Okay, there is no right answer for that. So this is based on your requirement. This is based on what you want to do. Okay, I would say weekly self-assessment is good. This need not be a formal exam like you sit for 1 hour and sit and do it. No, probably get 5 questions from your peers, answer them. If you do that, probably if you answer 50-60%, you can just go back and brush up the 30-40% which you have missed. This way, you can have a revision plan as well, and then you know where you're lagging behind. Okay. So can skip are those topics which you think that you have a fair idea on, probably 80-90% of the answer you already know. Okay, even if they ask you on the exam and you have not read it, you can still write it. So these are the topics that you are already comfortable with. Okay, so you need to segregate like this. You make a column. You probably take the contents page of a book that you're already referring to and then start ticking in them. Okay, probably you can color code them, whatever you want to do. Basically divide it so that you know the reds or the must do's and can do's should be covered as soon as possible. Okay, so stick to the time, always have a deadline. Okay, that is very important when you do this. Okay, so if you're not able to do this, you have to reassess and look at it that you complete that part in the next 1 or 2 days. You need to finish it there and then. Otherwise, 3 months is really difficult for you to keep lagging on later. Okay, so your self-assessment, I told you can look at your juniors, your seniors. Okay, someone who's interested in teaching you, probably you can ask them to just give 5 questions randomly. Okay, so it need not be whatever you have studied. Okay, if you have the plan that no, I've studied this topic, please give me these topics. Don't keep it as narrow as that. Just ask them for anything. Okay, it's always better to tickle your mind and learn something always. So you might be going monotonously by learning one topic. A new topic will always help you focus and plan better. Probably if that comes as a bouncer in an exam, you'll be able to do better. That's how you can even face a bouncer, I would say. Okay, so these are the things that you need to do as when you make a plan. Okay, so make a plan, stick to it, use peer support. Okay, so these are the few things that I could compile across as to how to approach an exam. Okay, so remember your plan, at least 80% you need to complete when you make it. Okay, so roughly 20% you can just put it on to the next 2 or 3 days and try and complete it as soon as possible. The most important thing, you have a plan, things are going on, but you feel that you're not able to finish it. So as soon as you get this, probably first or second week, your pressure starts building up. You start questioning yourself. Am I going to finish? Am I going to complete everything? Yes, this is going to happen. This has happened to me. This has happened to every person who has given an exam. The only thing is not to waste time thinking about it rather than keeping calm and just carrying on. Okay, that's very important. Start with topics that you know so that you can build momentum and confidence. And once you feel that you have completed fairly good amount of topics, right, your reward center start telling you, okay, this is good, and you can keep a steady progress. Keep spare times for those odd days. Definitely there are going to be periods wherein you'll have some sort of a mental breakdown or a burnout. Okay, so don't bother. Probably those days you have to just chill, just relax. Okay, at that time, if you still want to read something, if you're not able to read it out, listen to some videos or something like that, so that it will help you feel less guilty about wasting time, if at all you are having that. But definitely it doesn't matter if you're not able to do something after a period of time. Please relax. That is also very much necessary for you to come back and study better. Okay, so if your mind is not at rest because of your thesis, as I told you earlier, finish it and keep it aside. That's the only thing that any of us can say. Okay, so if you need help, probably there are a lot of people who can help you across, like your juniors, or when you have senior faculty, if you can request. Okay, so try and utilize all the support that you can get. So let us take an example. How to prepare. You have a plan. I told you what you're doing. You might get stressed. Okay, but these things, how do you go ahead? So even if you have a plan, you need to define, like, this week I have to complete this many chapters or topics, and that is the target, and that is the 80% that I was asking you guys to complete. Okay, so if you're exhausted, I told you, listen to videos, talk to your fellow batchmates. They might teach you something. Okay, or just go back to YouTube and listen to some of the videos that are already available. Okay, or the videos from top class, anything that you would feel that will build up your pace and momentum. Okay, if nothing is going, just go to bed. Okay, so always remember, if you're intimidated by someone who's studying better, or you feel that they are doing much better than you don't know the complete picture. Okay, so don't feel intimidated. Always keep calm and just say all is well. Things will get in line. Okay, just remember, you are the only person who can judge you, and you are the only person who can motivate you, and you are the only person who can do better. Okay, don't compare. So this is a brief timetable as to what I was using for my exams, and I thought I'll just telling you. So remember, always keeping things piling up. It you just exhausts you in the long run, and probably you'll not be doing well actually. Okay, it will reduce your efficiency in the long run. So what I used to do is have some topics for the pre-breakfast, pre-lunch, and post-lunch, and prior to coffee, because I was using those periods as the timeline where I could finish and then go to. Okay, try and not hurry up and finish at these times, but try and keep this as one of your rough guides. Okay, probably you can use anything that you want as well, but divide your day. Okay, our attention spans are low. We are aging. That is very important that we know. So probably 35-40 minutes, if you're able to give at the maximum 1 hour, the best person, if you can do that, that is good. Don't ask questions like how many hours per day that we need to study. That is something that none of us can tell. It depends on you. Okay, you can cram up a lot, but that does not reciprocate to learning. Okay, so cramming is not the thing that we are suggesting you guys to do. On the contrary, we want you to have some quality hours while you're studying. So that is what I want you to understand. Always, if you have extra hours left in a day or something, try and take a topic, a new topic or a answer. You just flip through the book and just look at a topic, and probably if you can read the topic and answer it mentally, that's enough. Need not write an answer. Mentally have a plan, okay, when you're approaching any question. That is very important. So relaxation, timeouts are very important. Don't torture yourself. Take breaks, keep hydrated, eat healthy. These are things that is necessary for any exams. I need not stress this, okay? And don't compare your current efforts with your pre-G prep days, okay? Probably you are doing 12, 14, 16, 18, I don't know how many number of hours. Just don't compare your old self. Neither do you have to compare it with your peers. Okay, that's very important. If you are someone who doesn't know how to start and you're feeling that you're not able to have a attention span, there's a technique, like most of you know, there are many other techniques, probably a Pomodoro technique, that is a short time intervals you fix and dedicate that time interval to finish a particular topic. Start with that. Probably you can build pace slowly. Okay, so this is still April the 22nd. Okay, so start right now. Probably you can start with 1 or 2 topics and then keep your pace building up. Okay, that is what you have to remember. Remember, whatever, no matter what the results of your exams are, you're already a specialist. Okay, and the exam that you're giving is a consultant level exam, so you need not worry about your capabilities and abilities. Okay, you are good enough. Only thing is, don't let fear take the better of you. Okay, so get good rest, especially the day prior to the exams. Don't carry the burden of the previous day. If you're not able to do well, if you've just finished 30-40% of the previous day's portion, don't dwell on it. Just go to the next day, start afresh. Probably come back to that after you finish that day's work. Okay, so that is very important. Keep yourself physically active. That actually is important, and don't let other things take toll on you. Okay, whatever happens will happen, but you need to keep that aside as well. Come over it and then go ahead. Okay, especially if you're too stuck on to sports. Okay, so few of you kept asking me what is the must read, where do I have to see. Okay, there are a lot of books that I can tell you, but the main core things is have a book that you have already read. Okay, this is just my suggestion, but this can be whatever you have read. Okay, if you have read textbooks, that is good enough. As long as you have made notes in the textbook, it is good enough. But reading the whole chapter again would be a little tricky and risky. Probably you'll be taking more time. Okay, so always, if you have notes, well and good. Otherwise, please try and use your AI, which is there already, to give you some notes. Okay, of the topics that you already have read. What I wanted to use is these 3 books. Okay, case-based review has a lot of topics which are mandatory reading. That is at least going to have your structural skeleton done. Okay, that is very important. And textbook of hemodynamic monitoring covers topics regarding echo, all your hemodynamic monitoring parameters, a lot of other topics which are small but really good for your exam. Okay? So these are the things that you need to finish as soon as possible. And definitely Washington is a handbook that you can carry daily at work. So this is one thing I would suggest you to say, probably one small topic when you're having coffee or tea, or in a day if you're working and you're able to complete one small chapter from Washington, that should still boost your efforts, telling that yes, I've completed something in the day despite me working. Okay, these are the things that I would say. Roughly it covers around 60-70%. Rest is whatever you have read. Probably there are a lot of articles, a lot of guidelines that you have studied. That is something that you have to read. Okay, so always have a note with you. Okay, that is very much important because it gives you confidence. Okay? The rest 25% are your update books, your IDs. Okay, and this ICU protocol books is something that I just saw that it did have a short answer. For a theory, it does look good, but it doesn't give you full points. Okay, but it gives you the headings in which you might have to approach. For that, say, it is just like a book that you can carry for your duties, so that in your free time you can go and learn those topics and tick them as well. It is similar to your Washington manual. Okay, so you can use these two as your short books, and rest of the things you need to go through time and again. So apart from your systems, apart from the hemodynamic monitoring and other essential things, your statistics, etc., topics which have been repeatedly asked are quality, safety, transplant, advances. Okay, there are trends which are gaining importance, the trends which are losing importance. So these questions have been asked. Okay, so these are the things that we want you to look into. Okay, ID is one big thing that we need to know, especially the AMR, ECMO, etc. There are a lot of topics. So what we can usually do by learning most of the things, you'll be only able to cover roughly around 95%. Rest 2 to 5%, we don't know what will be asked. Okay, that is the beauty of NB. They do find out topics that we really have not come across. Okay, so be prepared for it, but know how to answer it bouncer. That is what I would suggest. Okay, so your notes is the most important things. If you have made it, good enough, but if you have not done, don't grip. Okay, you look for people who have already made notes. I would still thank Niharika ma'am, because I have used her notes. I'm guilty because I have not made much, because I have used reading a lot of articles, but I have used Madam's notes. So if someone in your group has made notes, please share them so that you can also read and they can also benefit. And at the same time, if you guys are doing a peer group study, try and add on to those points. You can divide the topics which you have not made notes, like one person can add on to it and others can share and pitch in, so that the burden on a single individual would be reduced. This is one way that you guys can think about. There are a lot of places that you can get ready-made notes, like your D-range physiology, LIFTL, MCRIT, etc. Okay, so just use one of these and help you make notes. Especially in the era of AI, I think so it's easy, especially Notebook LM and all, just summarizes the notes. But don't always depend on them. Don't try to perfection them till the end. Don't research on them. Whatever it gets, please use them and move ahead, okay? Because you don't have time. So what are the don'ts? Don't excessively research. Don't dwell on maybe I should have done this. How will I write this? How will I complete this, etc. So don't go into the khayali pulao things that most of us get into during exams. Even I have gone through. All of us go through. What I learned is just forget about it and move on. Okay. So remember, no one has completed syllabus. If someone does, please tell me. I really don't recall anyone who has told that I have completed the syllabus, especially in critical care. Okay, don't compare your effort to the peers. Okay, so always focus on yourself and look into that you can do better than your previous day. Okay, so if some method is not working, probably that is not good for you. Okay, like a study group, or you're writing notes and it's taking too much time, just go on. Okay, so remember, if most of the times you're reading and you're not able to focus, it's always okay to just watch a movie, enjoy, go out for a dinner or something, or just Netflix and chill. Okay, but remember, it should be for a shorter time. So is that all? Definitely no. Revision is the core of everything. If you revise, only then you retain. Okay, that's very important. So start early, take small breaks, note down the points that you missed when you're revising. Okay, that's very important. And always when you come towards half of your topic end, right, that is when you realize that it's all interrelated. So you need to create a web of thoughts that if any interrelated questions are there, you can still write an answer. Okay, this you will get to know as you're preparing and as you start answering. Okay, always try to put all the puzzles together. You will definitely get the bigger picture. Okay, so the take home message is accept the fear. You have 3 months. That is the only fear that you have, but rest of the things are still doable. Okay, so have a plan, stick at it, revise, very important. Don't get into some nonsense of thinking what will happen if this or that, what if they ask this or that. Just try and read and complete things. Segregate the topics like I told you earlier. Must do's have to be completed. If you have something that you have already prepared well, probably you can keep them aside. Okay, so try and be confident always. There are a few bad days, just don't dwell on them. always give mock exams. Okay, we are also having 2 mock exams at the end of our sessions. Please do answer them. Okay, and please attend the debriefs as well. Okay, these are focused on your last minute preparations. Okay, thank you. Any questions you might ask in the chat box? Okay, or else I think so I'll ask Srihari to take over.
So, thank you very much, Dr. Darshan, for elaborating and guiding these trainees and candidates for the upcoming exam. I like the slide where you have mentioned about pre-breakfast, pre-lunch. Just like I was thinking, it is just like no insulin dosage for like no the 3 times, 4 times, and like no something like that. But that was very handy for the candidates to know how they should be dividing the time. So before I would be allowing Dr. Srihari and Dr. Amy. So I would take the official ritual of introducing them first because they are the gold medalists. So they should not be entering without the host introducing them. So if everybody allows me, so I would be first do that ritual. Yeah, okay. Because I always try to spice up my presentation. So this is something from 360 Critical Care Academy. We are all here glad and pleased to introduce 2 of our gold medalists. And the first, I would say the Lady Luck. Again, one more Lady Luck for our academy, Dr. Amy Ambuken. And I would not tell anything now. I would be just introducing Dr. Srihari. I would be keeping you waited for 5 minutes more. So please bear
Yes, sir.
with me because first, like no, the ladies first. So that's the rule number one. And so that's why I thought she should be getting the first, like the privilege to like again coming to our like no, she has taken time out. I just called her up like no, for one time and I expressed that if you can just spare some of your time to motivate the people now who are actually coming for the exam like no the after 3 months and she immediately agreed. So without any further ado I would request Dr. Amy, this is from our side, though you will be given the official gold medal by the NB president next month. So, but yes, we feel like we are like now getting the opportunity to also give you the gold medal. So, Dr. Amy, welcome to our show, and please, the stage is now yours for next 5 minutes.
Thank you, Tabasar. Thank you for the opportunity. So, first, I would like am I audible?
Yes, yes, you are audible. Yeah.
So, first, I would like to thank the whole 360-degree team, top class team like Tabasar, Darshan sir, Sri Hari ma'am, Sri Hari sir, Bhuwana ma'am, Niharika ma'am, and Sanatha sir for guiding me during my entire exam journey. Because when I entered for my super specialty course 3 years back in 2022, not 3, now it is 4 years in 2022. Literally, I don't know much about critical care. Then I started learning from my bedside. Each patient, each day is a new knowledge for me. So used to go back to home, used to see go read the cases, what I have seen in the bedside. I used to read about it. So that helped to build my concept. But still, I was not confident about my theory exams. I was having a very bad handwriting. I'm not good in time management. So literally, I don't know how to tackle my theory exams. And that was my nightmare from the beginning. When I joined for DrNB, from the day one itself, for the 3 years, what I feared was my theory exams, not the practical. Then how to tackle my theory, I was searching a lot for that because with this bad handwriting and poor time management, I literally was afraid of my theory. Then I came to know about the top class. And now I really feel that the top class has helped me a lot in molding on how to write the answers. The way you people have defined the questions, like how to approach the question paper, like how to approach the questions, how to approach each systems. The way you have organized the course, I feel it has helped a lot. Literally, I have attended your mock exams as well. And when I wrote the mock exams, I thought like, okay, I'm not going to make this. But again, I went through the notes, went through your videos you have given, and that helped me a lot to structure my answers. And I definitely feel that has helped a lot. So and even the confidence and the motivation you people have given before the day prior to exam. Still, I remember whenever we had doubts, we used to put in the WhatsApp group. Within 5 to 10 minutes, definitely one of the faculties will be responding to us. They will be coming up with some review articles, or even one time I have seen one of the, exactly I don't remember who it is, but still one of you people have written the answers in paper and have given to us. Definitely, I have to thank all the faculties for giving, for training us like that. And definitely that has helped a lot in writing our answers. And I owe this award to top class just because of the efforts you people have taken. Thank you, Tabasar, and the whole 360-degree team for the same.
Thank you, Dr. Amy. That was so nice to know about your like the idea of getting out of the doom's box. You told about something your handwriting was bad, something that we also didn't know, but that you overcame all of your fears to become the first one in the all over India. So proud of you, Dr. Amy. Please keep in touch. If we would be also at any point of time will be in position to help you also in your future endeavors in our own academic achievements also. Please be part of our courses also to train the future generation of intensivists.
Sure, sir, sure. Thank you.
Now, again, ladies and gentlemen, the time is here for the person I would definitely respect a lot, though he is junior to me. Each one of our team, they feel that he is someone who is the silent killer in academics, and he is one who can do anything for academics. So Darshan, you will agree with me. His
Definitely, sir.
notes are the hotcakes. He has prepared the notes, and he has devoted his time to clear the concept in his own training career, and also the way he trains people also in our on-site courses in Bangalore or in Mumbai. Last year we did it. This year we did it. So this is something out of box. So Dr. Srihari Rajkumar, now he is the consultant in Coimbatore, and Srihari, this is for you. So though
Sir,
I
I was waiting for Dhurandhar, sir.
Okay, so don't eat it. The gold you will get, and we will just use it to for the merrymaking. So please give it, courier it once you get the gold medal next month. Okay. So now it's all yours, Srihari, for next 10 minutes. How you want to guide your the future generation of intensivist.
Okay, sir. Sir, is my voice audible?
Yes, you are audible.
Yes, okay. So good evening to all. Thank you, Tapas, sir. Thank you, Darshan, for all the warm wishes. So with regard to theory preparation, like Darshan had told, most of it is what you think. Okay, so don't get stressed. Go with the flow. So that is the main thing. And the only thing regarding the preparation part is in the last 1.5 years, a lot of emphasis has come on clinical auditing and statistics. So when you are preparing for theory, if you are preparing for 4 hours a day, dedicate at least half an hour just for one question in any of those topics. Like if you have a question on sampling or if you have a question on randomization, you can read about it, prepare notes while you prepare the 4 critical care topics. So that way you won't keep this auditing and statistics till the end and get panicked at the last moment. So if you prepare this at the earliest, so you can use it for revision and that will help you a lot. So that is just one thing I would want to add on. So my discussion will be just to give you an overview of one of the talks that we'll be giving during this whole course. So I'll just share the PPT. So one thing I want to emphasize here is it is not going to be the routine seminars that you have been exposed to, like in CMEs or in other online platforms. The ones that we will be discussing here are exclusively only from an exam perspective. So we will not be going in depth into the topics. Whatever is needed from an exam perspective is what we will be discussing. So just to give you a model, thought we'll discuss about beta blocker and calcium channel blocker overdose, because this is one among the commonest questions that is asked in toxicology. Now, The problem with the national board is now they have started the system of branching questions. So previously, if they ask a question in CCB toxicity, it will be like a scenario and they will ask you in depth from the clinical manifestations, diagnosis, and management. Now they split it into three parts, usually three parts or a two-part question, and they usually give one question has what are the clinical features and diagnosis, and then second one will be another topic related to toxicology. So they can mix and ask. So you need to be prepared for any kind of bouncers that they are likely to produce. So with regard to beta blocker and calcium channel blocker overdose, these will be the main areas that you need to know about. The introduction, the pharmacology, the pathophysiology, the clinical manifestations, diagnosis, differentials, and the treatment. So this is not for this alone, but in general for any of the overdoses, if you go in this format, it is less likely that you miss anything. So coming to the introduction, beta blockers and calcium channel blockers are used for a variety of conditions, as you all know, like hypertension, arrhythmias, ischemic heart disease, or in others, especially portal beta blockers, like in portal hypertension, aortic dissection, or glaucoma. So overdose from these drugs form a minority of all poisonings, but the problem is they produce severe systemic toxicity and are associated with high mortality. So it is very, very important to pick it up at the earliest and initiate the treatment for this at the earliest to improve outcomes. So coming to the pharmacology and the pathophysiology, so with regard to beta blockers, it is basically a class 2 antiarrhythmics. So coming to the receptor classification and general mechanism, we can be split into three parts, beta 1, beta 2, and beta 3. So beta 1 is primarily found in the heart muscle, and activation of these receptors increase the heart rate, contractility, and AV conduction, and it decreases the AV nodal refractoriness. Beta 2 is predominantly seen in the bronchial and vascular smooth muscles, and activation leads to vasodilation and bronchodilation. And beta 3 is seen in the adipose tissue and heart, and activation of these receptors leads to increased thermogenesis and vasodilation. So the general pharmacokinetics that you need to know are most beta blockers have a variable half-life from 2 to 8 hours, but kinetics can vary in overdose, especially in sustained release preparations. So most of them are metabolized by the liver. So that is an important take-home message, because when you answer a question related to toxicity, when it comes to the part of elimination, you need to know about whether these drugs are removable by hemodialysis or hemoperfusion. Most of the beta blockers do not come in that category. There are only two drugs which can be considered. One is atenolol and other one is narolol. And they do say timolol and sotalol to an extent. So these are the important things you need to keep in mind. And esmolol, one of the commonly used ICU drugs, has a high plasma erythrocyte esterases metabolism. So with regard to the calcium channel blockers, it is a class 4 antiarrhythmic agent. So it can be classified into two parts. One is a dihydropyridine and a non-dihydropyridine. So dihydropyridines are actually vasoselective, and non-DHPs are supposed to be cardioselective. So DHPs, that is the dihydropyridines, they block the L-type calcium channel in the blood vessel. So the main effect is causing a decrease in blood pressure. So the compensatory side effect that occurs is tachycardia. So the common drugs are nifedipine, amlodipine, clevidipine, and nicardipine. Whereas for non-DHPs, it blocks the L-type calcium channels in the myocardium. So the main effects because of this is the decrease in heart rate and contractility, and it is contraindicated in patients with heart failure with reduced ejection fraction. And under this, you have verapamil and diltiazem. So with regard to the pharmacokinetics, these are highly protein bound with a high volume of distribution, and they are metabolized in the liver. So again, important thing is they are not amenable for elimination via RRP. That is renal replacement therapy. So as the dose is increased, the rate of CCP clearance is decreased, prolonging the half-life. So extended release preparations mostly prescribed for CCBs, especially diltiazem. So they usually given to facilitate OD dosing. So in overdoses, this absorption is unpredictable, leading to a prolonged duration of action. So coming to the mechanism of toxicity with regard to the beta blockers, it causes competitive antagonism of beta receptors. So that inhibits the adenyl cyclase activity, which is responsible for the conversion of ATP to cyclic AMP. This decreased cellular levels of cyclic AMP leads to a decreased calcium influx into the myocardial cells, and that causes a decrease in conduction velocity through the AV node, decrease in myocardial contractility, and reduce automaticity of the pacemaker cells. So other specific issues you need to keep in mind is lipophilicity, especially with propranolol. They rapidly cross the blood-brain barrier, which predisposes to CNS sequelae like seizures and delirium. Here it is mentioned very, very simply, but when you see patients who present with this kind of toxicity in real life scenario, it is very, very distressing because initially when they present, they would be having only the manifestations of your cardiac related manifestations. You would have initiated them on ECMO, they would be doing well initially. But over a couple of days, you would notice that the sensorium would have come down. You would do a scan and you would find that the patient is having a severe cerebral edema. And ultimately, you need to prognosticate, which will have a lot of communication related problems with the attenders. So it has that much of implications. Then you need to know about membrane stabilizing effect, especially with propranolol. So it inhibits the myocardial fast sodium channels leading to widened QRS intervals, and it can potentiate other dysarrhythmias. So that is an important thing you need to keep in mind. And carvedilol is associated with toxic epidermal necrolysis at therapeutic levels. So these are the other extra problems that you need to know in addition to the cardiac related complications related to overdose of beta blockers. So with regard to the calcium channel blockers, calcium channel blocker overdose selectively block the L-type calcium channels in myocardium and vasculature. So that leads to a decreased influx of calcium into the cell, leading to decreased excitation of the conduction system, reduced myocardial contractility, and vasodilatation, leading to a decrease in systemic vascular resistance. So all of these lead to hypotension and shock. So non-dihydropyridines cause peripheral vasodilatation, decreased cardiac ionotropy, and bradycardia. Whereas dihydropyridines, they predominantly initially cause arterial vasodilatation with reflex tachycardia, but as the dose increases, that selectivity towards the blood vessels is decreased. So it may involve the myocardium also, leading to bradycardia and hypotension. So this is why you need to keep in mind the reason. Amlodipine, nifedipine also can cause myocardial depression with higher doses. So coming to the clinical manifestations, the important points that are common to both beta blocker and calcium channel blocker overdose are nausea and vomiting, bradycardia with AV blocks, hypotension, drowsiness, coma, and seizures, most likely hypoperfusion related in the initial hours, but later because of the drug effects itself during the later phases, that is especially with propranolol, whereby after 72 hours they can manifest with cerebral edema. So with immediate release formulations, the symptoms usually occur within 4 to 6 hours, but with the delayed release formulations, it can take up to 24 hours for the symptoms to initiate. So with respect to specific findings with regard to beta blocker overdose, bronchospasm can be there, especially with non-selective beta blockers, but it can occur even with cardioselective beta blockers at high doses. Hypoglycemia can occur and seizures can occur, especially with use of lipophilic drugs. And with findings specific for CCP, there can be intestinal necrosis, especially with use of sustained release preparations of verapamil and hyperglycemia. So this is one thing you can keep in mind from an academic perspective. CCB overdose is associated with hyperglycemia and beta blocker overdose is associated with hypoglycemia. though in routine clinical practice, this may not be that evidently seen. So diagnosis, CCB and beta blocker overdose are mainly based on history and physical examination. So that is the important thing you need to keep in mind. So history data obtained should include the specific agent, the amount ingested, the time of ingestion, whether there are any co-ingestions, and underlying history of heart failure. Because if there is already history of heart failure and they have taken an overdose, it is associated with more severe hemodynamic compromise. So in general, patients ingesting 5 to 10 times the normal dose can develop severe manifestations, and specific agent with immediate or sustained release and the time of ingestion determine the type of gastric decontamination method. All right. So here I mentioned about these 5 points. These top 4 points. It is applicable to all other toxins also. Then coming to the bedside assessment, initially you go with an ABG. You can identify the presence of metabolic acidosis, which will be predominantly lactate related. An initial lactate more than 3 millimoles per liter is usually associated with poor outcomes. And presence of hypoxemia is usually associated with the presence of pulmonary edema also being present. So you can also assess the capillary blood glucose. If it is hypoglycemia at presentation, it can go preferably be a beta blocker overdose. If it is hyperglycemia, then it could be possibly a calcium channel blocker overdose. ECG is a must. So with beta blockers, any form of bradyarrhythmia is possible. AV blocks can be there. Membrane stabilizing effect can be there, whereby there can be QRS prolongation. And with use of sotalol, there can be QTC prolongation also. With regard to CCBs, any form of bradyarrhythmia also can be present similar to beta blockers. But here, one thing importantly you need to keep in mind is usually the QRS and QTC is unchanged. But if there is hypocalcemia which develops, then QTC prolongation can be there. Then lab testing, serum electrolytes, blood urea, serum creatinine, and LFT can be done to assess for end organ dysfunction. Then serum acetaminophen levels and salicylate levels, that is to assess for co-ingestions if it is present. And radiology, initially chest X-ray can be done to assess for signs of hypoxia, that is to look for pulmonary edema. Another thing you can mention is bedside focus. You can assess lung ultrasound and you can do a cardiac ultrasound to assess for any cardiac dysfunction and to quantify its severity. So when you mention about the approach to diagnosis, it is always important to always mention the differentials. So the 3 important differentials you need to keep in mind is one is digoxin overdose, where there will also be ST segment scoop depression. With clonidine overdose, there will be meiosis with somnolence. Then with cholinergic drug overdose, along with bradycardia, there will be salivation, lacrimation, urination, and defecation. So coming to the treatment part of it, so the first part of it is acute stabilization. So airway and breathing, intubation and mechanical ventilation needed if there is impaired mental status with poor airway control or severe respiratory distress with hypoxia, whereby there is failed NIV. With regard to circulation, if hypotension is present, initially fluid boluses with crystalloid can be given based on the baseline volume and cardiac status. If bradycardia is there, you can initially treat it with atropine, 0.6 milligrams IV every 3 to 5 minutes to a maximum of 3 milligrams with advanced hemodynamic monitoring and central venous catheter for vasopressor and inotropic administration. So then the next part is gastrointestinal decontamination. Activated charcoal, a dose of 1 gram per kg, maximum 50 grams to all who present within the first 2 hours. So that is the important take-home point. Unless contraindicated. So patients with a depressed mental status who are not intubated or presentation more than 2 hours, ideally in this situation, activated charcoal should not be given. And just for giving activated charcoal, you should not intubate the patient. So this is not just from this case perspective alone, but in general. Then other modalities are whole bowel irrigation, 2 liters of polyethylene glycol based preparations for potentially life-threatening ingestion of extended release preparation via clear rectal effluent. Gastric lavage is not routinely performed, mainly for patients who are presented within 1 hour of large quantity ingestion, it is usually said. But now the evidences towards that is now becoming very futile. The theoretical reason they say why gastric lavage is not preferred is they say that with the gastric distension becoming very severe, that itself can stimulate the vagus nerves and that itself can lead to bradycardia. So all this is theoretical, but in practice, activated charcoal is taking higher priority than gastric lavage. So just an overview of the first two parts of it. That is the stabilization and decontamination. You go with the ABC, consider decontamination, and you assess for signs and symptoms of toxicity, like bradycardia, hypotension, reduced contractility, and impaired mental status. If none of them are there, you observe. If they are there, then you go with advanced hemodynamic monitoring, early assessment of cardiac status, fluid resuscitation, and then you go to the first line treatment. So coming to the first line treatment, first line is IV calcium to increase contractility and blood pressure. So you go with bolus of calcium gluconate of 30 to 60 ml of 10% solution, that is 3 to 6 grams, or calcium chloride of 10 to 20 ml of 10% solution, that is 1 to 2 grams. Following that, you can keep an infusion of 0.5 milliequivalents per kg per hour with regular monitoring of serum calcium and ECG monitoring for hypercalcemia. So usually you can assess for presence of QTC narrowing. So that will be one of the identification factors for presence of hypercalcemia. And another academic based important question that can be asked is, if there is severe hypercalcemia, there can be presence of Osborne waves. Osborne waves are usually present in hypothermia, all right, but in severe hypercalcemia also it can be present. Then with coming to vasopressors and inotropes, noradrenaline to increase the blood pressure, you start at an infusion of 2 mics per minute to a maximum of 30 mics per minute, or you can go with a weight-based regimen of 0.05 to 0.4 mics per kg per minute. The target systolic blood pressure is more than 100 millimeters of mercury. Then if it is ineffective, then you can add adrenaline also to increase the contractility and heart rate. Here also you have an infusion rate based regime and a weight based regime. So infusion rate is between 1 to 40 mics per minute and weight based is 0.01 to 0.5 mics per kg per minute. Alternatives that can be used are dobutamine or isoproterenol. Then high dose insulin euglycemic therapy. It is mainly to increase contractility and blood pressure. So the mechanism of action is very, very important. So under normal circumstances, myocardial cells derive energy from the free fatty acid metabolism. So in shock, the substrate changes to carbohydrate metabolism. So in CCP or beta blocker mediated shock, cardiac myocytes cannot utilize these carbohydrates due to decreased insulin, inhibition of calcium mediated insulin release in the pancreas. So high insulin euglycemic therapy has two benefits. One, it increases the transport of glucose, lactate, and oxygen into the myocardial cells, improving inotropy. And it increases phosphatidyl inositol kinase activity, which leads to an increase in nitric oxide synthetase, which leads to vasodilatation. And that helps in improving the microcirculatory flow in the coronary and peripheral vessels. So the dose usually goes with, as you go with short-acting insulin, insulin actrapid at 1 unit per kg as a bolus. Following that, you give 1 unit per kg per hour as an infusion. And simultaneously, you need to start a dextrose infusion and maintain euglycemia. So within our ICU protocol, we keep it between 140 to 180. So that infusion rate varies person to person. There is no fixed dextrose infusion rate. So you need to monitor the blood glucose, potassium, magnesium, and phosphorus at regular intervals. So if no effect is seen within 30 to 60 minutes, then you can increase the infusion rate. Then coming to ivaglucagon. So the main benefit of it is more for beta blockers than calcium channel blockers. So it produces chronotropy, positive chronotropy and inotropy effect via the glucagon receptors, which increases the cyclic AMP, which causes a significant increase in heart rate with a mild increase in blood pressure. So it is given as a bolus of 1 to 5 milligrams IV over 1 minute, maximum of 15 milligrams IV total, and then an infusion of 2 to 10 milligrams per hour is kept. So the problems are it can cause tachyphylaxis, nausea, vomiting, and hyperglycemia. So if it is refractory to your first line treatment, that is your calcium, your vasopressors, and inotropes, then your high insulin euglycemic therapy and glucagon, then you need to go for the next subline of therapy. That is, if there is bradyarrhythmias with optimal contractility, temporary venous pacing can be considered. Methylene blue can be considered because the mechanism of it is inhibits nitric oxide related cyclic GMP, which leads to inhibition of nitric oxide synthesis, which helps in vasoconstriction. So, especially in CCP overdose where there is vasodilatation, it may have a role. So, it is given at a dose of 1 to 2 milligram per kg as a single dose. Then, enhanced elimination with hemodialysis for dialysable beta blockers like atenolol, sotalol, timolol, or nadolol, but you need to consult a nephrologist. And intralipid emulsion is usually only salvage therapy. It is not part of the first line. So it acts by intravascular sequestration of the drug toxin by lipid emulsion. So it helps to decrease the free concentration of drug in blood, redistribution of drug from the tissues, and it decreases the total drug concentration. So the dose is very important, both from a theory and practical perspective. 1.5 ml per kg of 20% given over 2 minutes, the response being seen usually in 5 minutes, and following that, the infusion is kept at 0.25 milligram per minute for 24 hours. So the side effects are triglyceridemia related pancreatitis, acute lung injury, and interference with your biochemical testing. So these are the important side effects that you need to keep in mind. So rescue therapies, VA ECMO if it is available, it allows the time for the drug to be redistributed or metabolized till the heart function recovers. Though associated with many complications, timely intervention with good expertise is usually associated with good outcomes. And additional interventions which need to be done are if there are ventricular arrhythmias like torsades pontis that sets in because of prolonged QTC, then IV magnesium needs to be added. If it is unstable, then you need to go with cardioversion or defibrillation. And if QRS is prolonged, then it can be because of beta blocker with membrane stabilizing activity. So whereby you need to administer IV sodium bicarbonate. Thank you.
Thank you, Dr. Srihari. I know this topic is something like we hardly encounter. I would be like sharing with you 2 days before we in our hospital ICU has also encountered a case where we suspected it's calcium channel blocker overdose, a young female 32-year. We did everything, but somehow the history was not very clear. So despite initially improved, but finally the patient succumbed because it was a very severe overdose. So this type of cases you will definitely encounter. And I believe if you know the format of writing a toxidrome, so the overall management protocol as well as how you would be approaching becomes little bit easier to write. If it is not directly beta blocker, maybe something else, but yes, the format remains the same. Now, thank you, Dr. Srihari and Dr. Darshan. Now, before concluding, I would request our super ladies, Dr. Niharika first and then Dr. Bhuvneswari to please share some of their own experience as well as tips and tricks to the trainees who are appearing for the next exams, maybe not in July end, also in the future also exams. So how they should be preparing. So first over to Dr. Niharika.
Thank you, sir. Thank you. So first of all, I should thank for sir to giving this opportunity because this also helps us to learn all the new things because we need to teach the other students. So we are also actually being updated by the newer guidelines. So thank you, sir, for taking me into this course. And the most important thing, see, most of it has been covered. I think Dr. Darshan, Tapas, sir, everyone has told how to read and all. Two important things from my side. One is start positively. Okay. Don't think that, no, is it possible? Only 3 months, will I be able to complete it? Or don't worry that, okay, my seniors' results were like this. No. Okay. So everything changes with time. So be positive, start with the positivity. Yes, you can do it within 3 months, because all these 3 years, basically, if they give DKA, yes, you know how to manage it because you are being managing the cases. But in the exam, you should know what to write, and more importantly, you should know what not to write so that you can save the time. So writing in an exam is an art, so you need to just practice that art in these 3 months. Okay, so just jot the most important points. If they ask about acute pancreatitis, so what should be written in your paper is the one thing that you just jot down the points, so that it helps you for an easy revision also. Okay, so I think these two things I wanted to tell. So
Thank you,
let's
Dr.
start.
Niharika. You have been outstanding in our previous all like the initiatives, and we hope to continue with the same spirit that you have showed for last few years.
Thank you, sir.
So now, Dr. Bhupneswari
Hi,
from
sir. Hi.
Dubai. Yeah.
Yes. Hi, everyone. Thank you, Tapas sir, for giving us this opportunity, because as Niharika ma'am said, after 2 years of completing the course, we are still updating ourselves to give better quality content to the students. And coming on to the students, I think you have 3 more months, which is an adequate time. Don't doubt yourself. Start from tomorrow, day one, as Darshan sir said, make a timetable, start from tomorrow, like make your notes, start from tomorrow, include statistics, cover the basic parts, like basic chapter wise questions first, and then to the advances, because nobody in a question paper, there is no 10 advanced questions alone, there are basic questions too. So don't doubt yourself, start from the basic statistics and the advanced question. Whenever time permits, please go through the evidences and guidelines. We are all here. I know you all have family. Being a family person as well as being a student is not easy. Being a top student, I can assure you the content here are the quality rich content which will help you pass the exams. Just be confident. Any doubts, anytime you have, do ask us. We are there to support you, and all the best. We will be there with you throughout the journey. All the best for the journey. Yeah, thank you, sir.
Yeah. Thank you, Dr. Bhuvneshwari. And I would be ending with the course details that we are coming with. Now, this is the course agenda. I know you would be all curious, all the trainees, how we are going to help you out. So this is the provisional the agenda for the next 3 months from top course. So we would be starting from 29th of April, and we would be providing you with all the system wise the presentations which would be covering all the questions. So we are targeting almost 150 questions. Believe me, 150 theory questions, which would be covering the whole critical care. And that would be definitely if you prepare those 150 questions, you will be definitely getting 50 plus related questions also immediately. So it is 200 questions, and you are expecting only 30 questions in your 3 papers. So believe me, that is going to help you. And also at the end, if you see here, first mock exam and the second mock exam, again June 27 28 with debrief 29 and 30, and July 4th and 5th with debrief at 8th and 9th. So definitely this is going to give you the confidence that you need before going for the final match. So all the details would be posted, and please be in touch in our WhatsApp group, as well as if you have any doubt, please directly call me, and we would be definitely help you out with our course materials. Thank you very much at the end. And if you have any queries, please don't feel like shy. Post in our groups. Our faculty would be definitely helping you out. Thank you, Dr. Darshan, Dr. Srihari, Dr. Niharika, Dr. Bhubneswari, Dr. Sanant, Dr. Emi, everyone for joining this introductory class for the future of our critical care. And definitely the future is bright, and definitely we will reach to our destination. Thank you. Take care. Bye.
Thank you, sir. Bye.
Thank you. Have a good day. Yeah.